So this has been a hybrid meeting. Hybrid meetings are always a little bit complicated because you can have speakers and you can have chairs that are at home, so the flow might be a little bit interrupted just because of these things. You may encounter some technical difficulties that I would say that they are less and less because we are really experts in organizing ourselves in the different platforms that we have the possibility to use. And I would say that basically TCT has had three major focus. Of course, cellular therapy other than stem cell transplantation has been one of the major focus. We have already been discussing about these debates of CAR-T versus autologous stem cell transplant in lymphoma and multiple myeloma, but there have been other sessions, or plenary sessions, symposiums, and oral communications that have been devoted to CAR-T, not the constructs that we are using outside prospective clinical trials, but constructs that are being used in prospective clinical trials. So cellular therapy has represented a big part of the meeting. Then we have had the second part I would like to highlight is basically the ones dealing with the usual complications of stem cell transplantation, so GVHD, infections, cellular therapy against viral infection, which is an area also of quick development, which is really very interesting for those patients that are not able to clear up virus just because they are very immunosuppressed and they don't respond to the usual antiviral therapies. And then I think that another important, interesting part of the meeting this year, well, probably it's not exclusively for this year, and it's happening one edition after the other one, is the interest of having globalization of cellular therapy procedures with the objective to try to implement education, clinical standards and quality standards around the globe. So there are several initiatives, well, in this case coming from ASTCT and of course coming from other transplant societies that try to improve the accessibility to transplant education, or at least to understand which is exactly the situation in different parts of the globe and to be able to improve it in the future. And I would say that that's another relevant part of the meeting.